IP. Julie is going to go through that for us, and every other standing committee is going through them in the month of February. Is that right,
It is,
Aaron?
yes.
Okay, great.
If I could, I would like to just kind of kick it off just with a
Sure.
general description of sort of where we are in the process.
Okay,
And,
excellent.
So, departments in January were building their projects. Some new projects in there. The one project that this committee will review today is a new project, but in the CIP overall, there's some existing projects that were approved in prior versions of the CIP, and so if it was an existing project, the costs were updated. We kind of go through our estimate process and things like that, and so moving into February, that's when we're going to standing committees. So departments are presenting those projects at standing committee. This will be the last one of the month. Generally, we're just kind of looking for the project review, getting your questions and your feedback on the projects themselves, how they fit in with our overall priorities and things like that, right? Simultaneously, the budget team and the county execs team are reviewing all of the projects in totality, kind of looking to see how the funding requests mix in with the funding available. And that'll all eventually be packaged into a full CIP that will get presented to the executive committee in March, and then the full board will hopefully approve that via resolution in April. So again, just kind of wanted to give you a feel for where we are in the process. There was just the one project in the packet from the Human Services Department. Julie's here. She can answer any questions on that project. I can answer other CIP general questions as well. So thank you.
Thanks, Aaron. Okay, Julie.
If you want me to give just a quick overview, in 2019, the county board approved $1 million investment into a new electronic health record for the Human Services Behavioral Health Division. That new EHR has been instrumental in us both in tracking, the work that we do, the outcomes for clients, but also improved our billing and increased our revenue. So I think that has been successful overall, but as you know, many of us know that any system that you purchase soon becomes fairly obsolete. So we were notified in 2023 that this system, My Avatar, is moving to a new platform called NX. And at that time, counties were allowed to move to the new platform on a volunteer basis. And so because we had just implemented, we chose at that point not to invest into moving to the new platform. We've been notified that come 2026, 2027, you will be forced to move to the new platform. And so this cost estimate is a high estimate based on what NetSmart My Avatar has given us as to the cost to upgrade our system to the NX. And so it's about $100,000. And so at this point, depending on approval and depending on the time frame from the county executive and then the county board, we'll look to upgrade in 2026 or 2027.
Any thoughts, any comments, questions? Chris,
Okay.
Supervisor Bossert?
So first thing is, I just want to make sure that this is not going to be something where this is an initial cost to explore it, and then there's going to be a bigger cost in 6 months. I don't get that impression, but I just want to verify that.
That's accurate. So this is a high-end cost. They quoted us 2 costs. One is if they just upgrade us and we figure it out on our own. And the high-end cost is if they upgrade us and then they actually also do some of the programming for us. So depending on where we are with our IT workload, then it will depend on which we choose. But it is a one-time cost. We do already have some dollars in our budget for sort of any upgrades that we want to do. If we want to create new forms or we want to create new programming, that's already budgeted. And so we would spend any additional dollars out of our budget.
Okay. And then is there any possibility, and I realize this might be a no because this might be too broad, but is there any possibility that this could be covered by the grant money for the opioid settlement instead of capital improvement?
I'm not sure. I think it's certainly worth exploring, and we certainly can bring that up in our discussion with the county executive as well.
Okay. Overall, I support this. We need to make sure that you have the tools you need. I know when we went to electronic health records, while it cost $1 million, an effect of that is it saved us much more than that. I'm sure you would agree with that. In fact, do you have any offhand estimate as to what the electronic health records may have saved the county?
Yeah, I wouldn't say, it's hard to say. I mean, I think we've done a lot of improvements and efficiencies in our work. And so, in that we have streamlined some of our positions and reduced some of our positions. But I know that in the 24-25 budget, I budgeted a 5% increase in Medicaid revenue just based on our ability to track and bring in revenue at a higher rate. I just came from a finance meeting, and it looks like in 2025 we actually had a 10% increase in Medicaid revenue. So we exceeded what our projection was.
So we're increasing revenue, and we're able to reduce a few positions. And of course, those positions are recurring expenses. So, if we save $200,000 in staff per year, over 5 years, that's $1 million right there, too. So that shows the value of these systems. They do give us the tools we need to be more efficient with tax dollars. So I think this is great that we're doing this. We got to do it, of course, but I support this 100%. Thank you.
Thank you.
Supervisor Galitz.
Yeah, well, I don't disagree with that. We saw those savings, but we've also recently brought on new staff. So any staff savings we've already spent again.
Yeah. If I can offer a counterpoint, the staff we brought on are going to be paid for through those specific programs and the Medicare reimbursements they're going to get there. So it's not quite an offset by any means.
Right. We just have
Yeah.
to be careful. I mean,
I agree.
remember back in 2019, and Ms. Driscoll may remember this, I asked her very pointedly in a meeting is, when are we going to see those realized staff savings? And the comment was, well, it takes some time to integrate, and I think it took over 3 years to be fully integrated.
Mm-hmm.
So, did we actually see less staff in that area of, call it, processing, right? Because if the claim was that we'd be more efficient and effective and therefore need less people to input, did we see those realized savings? And this is just a general comment. It's not to go into those details today, but I think broader on all of our programs, if we say there's success criteria, we should hold ourselves accountable to that. Has that actually occurred? Have we seen those realized savings? If that's indeed was what part of the quote-unquote pitch was, right? Not only would we see increased revenue, such as just described, 10%, I think you said? Mm-hmm. What about the other parts of it?
I agree with that.
Those are the things that I think we need to hold ourselves accountable, and in committee meeting, that's where it starts, right? That's where we need to ask this, because hence my reason for this is 2019, if we had X staff, well, where are we today in 2025? And do we have the same number of people doing those processing? If we have the same number of people doing those processing, well, then we failed in meeting that objective of reducing staff in that particular area, if that makes sense. So that's where we have to hold ourselves accountable.
Take a look back and check
Would,
it.
would you like me to comment on that, or?
Sure, absolutely.
Okay. I don't know that direct care staff can be an actual demonstration of the implementation of electronic health record, but I think it can be staff that are paid for by tax levy. While we have come to this committee and asked for several of positions for certain areas, we've actually also increased the number of staff that are providing services to our community by contract that are not county-funded staff. And the reason we've been able to do that is because we contract with them through a fee-for-service concept, meaning that they hire a case manager. The case manager does the work in the community, and they bill Medicaid, and that's what we pay them. We don't pay them any more, any less. The needs of the community are growing, and I would say that our services have grown as well along with that, but we have not added any county-funded staff that are funded by the tax levy. And up until 2024, the Human Services Department actually reduced our tax levy by $1 million. Now, we probably are seeing that creep up over in 25. I think we increased our tax levy by maybe 100,000 and likely going to see that in the next couple of years as well. But that's primarily due to the increased cost of maintaining the staff that we have and providing those COLAs or those things that are approved. So it's hard to talk about it as like apples to apples. And so I think, one of the things that we look at is, are we maintaining our tax levy while also meeting the needs of the community? And so while our budget may grow, it's primarily around the revenue and the grant dollars that we bring in.
Thank you. Any other questions or comments? Okay. So I think it looks like we're all in agreement that moving forward, this makes sense. And is that good, Aaron? Okay.
Actually, real quick, so there's something about sunset. So will eventually we have to get to new programming? Sorry. So this is a change, an upgrade, I guess. So are there additional ongoing like user fee increases or licensing, or is that part of that 100K?
So we do have budgeted license, we have yearly licensing fees that we have. The $1 million that was originally committed to the project for 5 years has been expended. And so now we've worked in the ongoing costs of the system into our regular budget. So there are licensing fees and there's hosting fees that are required. That's already budgeted. This is essentially to move to a one-time cost to move to this new platform.
Thank you.
Got it. All right. Thank you, Julie. Our next item will be the 2024 Youth Justice Data Report. And Coral is going to, with a partner, present that.
Yes, actually, Beth Wonke will be
Beth,
presenting.
all right.
Let me just kidding. Hold on. Reopening my desktop. What? Do I have to? I will set some context. If you remember, we were here last month talking about Child Protective Services trends for 2020 through 2024. So we thought this month we would bring the youth justice trends, which those are youth that some of them have been adjudicated delinquent, and Beth will talk about the various paths for juveniles that come in through our division. And this information will then be related to additional information we'll be talking about this evening.
Thank you.
All right. Hello. Good evening.
Hello.
Nice to be back. So as Carl said, youth justice intake, that encompasses youth in our community who are aged 11 to 16 that have had some sort of law enforcement involvement, which has led to them being alleged of committing a crime under the Wisconsin Criminal Code. The other referral that comes through youth justice is for truancy. So when youth are chronically absent from school, we can receive a referral in the youth justice department for that as well. So that's what these intake numbers are going to show. So this first slide is a total referral trends from 2020 through 2024. So you'll see that each year is highlighted. And then the dotted line is the trend line from 2020 to 2024. So over the last 4 years, our referrals in the Youth Justice Department have increased by 9% total. How that relates between the delinquency referrals are those youth that have been alleged to have committed a crime, and then truancy. On average each year, it varies a little bit, but usually 90 to 95% of that total referral is for delinquency, and the other 5 to 10, again, each year kind of varies, are for truancy. This next data trend shows the different locations within the community as to where these referrals come from. So the blue line is within the community, so that could be a youth at Regner Park who damages a bathroom. Home would be a caregiver called law enforcement to the home, and there was some sort of alleged criminal activity within the residence. And then the green line are school referrals. And so school referrals, again, encompass those truancy referrals because they come directly from the school staff, or those delinquency referrals for youth behavior that has occurred in school that is alleged to meet a criminal statute in Wisconsin. So what this graph shows is that the trend of referrals coming from the community and inside the home are decreasing, while referrals within the school settings are increasing. And I'm assuming that 2022 is very high because that was probably the year that most all the kids were back in school. I think, right, most of 2020, and I think even most of 2021, a lot of kids were at home in virtual school. So I think that's probably why 2022 has that big outlier there. So those two slides show us, or that last slide shows us, that referrals for behaviors in the home have decreased by 3% from 2020 to 2024. The community referrals have decreased by 8%, and referrals within the schools has increased by 37%. And so then this shows the disposition of the intake. So when we get an intake, a worker meets with the youth and their family. They also talk to other collaterals, and then there are 3 decisions we can make. We can either close the case, which means we're no longer involved. We can open it up on a deferred prosecution agreement, which is what DPA stands for. That is a 6-month informal agreement between Human Services and the youth and their parent, that they're going to abide by expectations that are set mutually. And then a social worker follows that youth for 6 months, and then the intervention is completed. The third outcome is petitioning the court. So that would be that we would send a referral to the district attorney's office and recommend that the youth go through the juvenile court system, which involves disposition hearings and court-ordered conditions, where they also get a social worker that follows them through that court order. So this shows the trend of the intake decisions where we open a case and service that youth after getting that referral. So you'll see that deferred prosecution agreements it looks like they have stayed the same. However, they have decreased by a few percent from 2020 to 2024, and petitions are steadily decreasing, which shows that we're not sending as many kids over to juvenile court to go through the formal court process. And so how we've been able to achieve the decrease in sending youth through the youth justice system. In 2020, Washington County, the youth justice workers received a lot of training through our state partners for a risk assessment. It's the Youth Risk Screening Instrument, or YAZI for short. It's a series of questions that the worker collects information during the meeting, and then it scores the youth of their risk level to continue in they call it reoffending behavior. So it comes out as low, moderate, or high. So we've really been increasing using that assessment in our decision making, which has resulted in us not opening youth for interventions by incorporating that assessment into our decision making. So that's resulted in the deferred prosecution agreements decreasing by 46% over the last 2 years. The last 2 years are noted because we really started implementing the YAZI risk assessment in 2022. 2020 through 2022, we were getting trained in implementing it and getting familiar with it. And then from 2022 to 2024, we decreased youth that went to court by 57%. And that's it.
Thank you.
Questions, comments?
Yes, Supervisor
Yeah,
Gallus.
sure. So I like to, so we implemented
YAZI.
YAZI, sorry, thank you. Implemented YAZI as a tool to help, it's a tool, but what I'm trying to get at is the outcome, right? So maybe before we were more youth offenders, if that's the term, were in the system in one of those two categories. So where did they go then outside of that? Did they have additional counseling? Something was bothering them to act out. So instead of going one of these two routes, something happened, right? So do we have an idea of what's happened there? Or have they received, counseling from their school counselor, from some other sort to help them, through their, behavior or mental health or whatever else?
Yeah, that's a great question. And the YAZI screen does ask a lot of questions around mental health, trauma experiences, family dynamics, substance use in the home, mental health with parents. So we are screening all of those things on the front end. And the answer is yes. So if they do not get opened for services in that informal agreement or going to court, the intake process takes about 40 days, and so during that 40 days, the intake worker is making referrals within the community for those low-risk youth that don't need to be serviced in the actual juvenile court system. We work pretty closely with our behavioral health unit, doing a lot of referrals to the Comprehensive Community Services, or CCS, mental health program. And our intake worker works directly with those mental health professionals to get kids screened if they're not already in those services.
So that we're avoiding some of that labeling, let's call it that, which could stick with you for a long time.
Absolutely. I think prior to implementing the YAZI, we were using a lot of the deferred prosecution, those informal agreements, to provide to get the youth services, but as you just said, then that starts the process of them in the court system. So if another referral comes in even 2 years later, if they were already on a deferred prosecution agreement, they most likely often then go to court because they already had an intervention and they're getting a new referral. So by making these community referrals and these connections, it's not putting the children in the juvenile court system that don't need to be serviced through that punitive lens.
And sorry, one more question to tie into this. So we've added to the sheriff deputy, I can't remember the term.
The co-ride?
The crew team?
Co-ride. Have they been involved in some of these instances that helped keep them going on those two paths that you described here?
That kept them going through the youth justice, or
No,
diverting them
kept
out?
them from even
Diverting them
getting
out.
there.
There have been a handful of families that crew has been involved with that we were able to connect with, and we're still working with acute care services in the sheriff's department on how to keep referring kids to that program if they're not already connected.
Got it. And then lastly, most of the high schools have a liaison officer, et cetera. So are those individuals getting additional training such as awareness on Yazi or others to, you know, to defuse situations, and sometimes you just need someone to talk to?
Yeah, we do have a monthly Washington County School Law meeting that meets, it's all of the local law enforcement jurisdictions, us, victim witness, the district attorney's office, all school admin staff, where we do talk about a lot of these things to provide that community-based training. I know that the school resource officers, I believe, the Office of School Safety has separate training specified specifically for them.
Thank you.
Supervisor Bowser.
Okay, so you mentioned the effect of COVID, and I look at the data between 2020 and 2022, and I can see a definite spike there. And then we implement Yazi, and we're starting to get some better outcomes, which is great. I love that. I think one thing to help us figure out the impact of COVID would be to go backwards with this data back to maybe 2015. I'd be curious if you have that capability to see what that would look like, and whether 2022 then was a return to normal, or whether it was a spike beyond, because you know, being out of school for kids for a year or two was extremely disruptive to their normal routines. So I could see 2022 almost being a spike above normal as like a reaction to being back around other kids. You know what I mean? So I'd be curious to see that data and how it goes. But definitely good job with implementing Yazi and improving outcomes through that. So thank you.
Yes.
I think it's worth mentioning that before 2020, we used the assessment tool called Compass. Compass is actually the tool that is used for adults, but there was nothing that was really available to assess juveniles. So, I mean, I think the biggest change, and you correct me if I'm wrong, between using Compass, which is a great tool, but again, it's not meant for kids, it's meant for adult offenders, is that the Yazi takes into account like the family dynamic and the youth's strengths and kind of their support system and other areas of their environment, like school and peer relationships and things like that, that help give us a really clear picture of what we can build on with these youth and how we can support them differently, and also using the natural supports they already have. So I think that's been a big piece of this too, integrating the family.
So in as much then, having used two different tools, Compass before 2020, you would be comparing apples to oranges if you look back at the data. Is that accurate?
Maybe, because I do not believe Compass was, what's the word? I mean, it wasn't designed for juveniles, but I don't know if it's completely apples to. I don't know if it's completely apples to oranges, and I'm very intrigued by the question from Supervisor Bossert, and I think we're going to try to do that. So I think it's worth looking at. I don't know if it's exactly apples to apples, but I don't think it's apples to oranges.
I will.
That makes,
Yeah.
Okay, it'll be bananas then.
Yeah. The other notable difference with the data is, so previous to around 2020, actually really 2021, DCF, or Department of Children and Families, did not oversee youth justice. So it used to be overseen, there was a section of Department of Corrections that was juvenile corrections, and in 2016, 2017, DCF took it over, and they've been slowly implementing it into similar practices as child welfare. And so we did not start using the system where I pulled this data for youth justice documentation till probably maybe even around 2019, 2020, really consistently. But we can definitely do some digging, for sure.
We definitely have it in paper form somewhere. We can find it.
Yeah. I think to Jody's, Chairman Schulteis's point, when we look at things like referrals, I don't know that would be impacted by switching from Compass to Yazi, but outcomes things like the open case disposition, that definitely would be impacted by that. Now, the other thing is, you mentioned the switch over to humans, I think you said Health and Human Services, right?
Yeah, it went
DCF,
from
yeah.
corrections to children and families.
Children and families.
Yep.
That might impact referral trends a little bit depending on some of the details of that.
I think that might also.
Or maybe not.
Oh, sorry, go ahead. I didn't mean to
No, go ahead.
I think that might have a decent impact on the case disposition outcomes, because I think practice trends and training and our guidance from the state changed when it went from corrections to Department of Children and Families, where they really encompass child welfare service, or sorry, youth justice services under the child welfare umbrella. So I think we'd see some of that on the back end for sure.
Yeah, I do think the switch from Compass to Yazzie is a good one. You know, you mentioned peer interactions in there. Well, anybody who's raised a 15-year-old knows that when they're 15, their perceptions of their peers are everything to them. That's like 99% of their identity at that point.
Right.
Maybe I'm exaggerating a little bit, but it's extremely important to them how they fit that social interaction component. So, and Compass didn't have that, so that's a big change and a big positive. So, yeah.
I agree.
I will also comment as well, the increase in referrals, I think youth culture, if you want to call it that, has changed wildly with social media, access to social media. And so I think a lot of what we're seeing with these increase in referrals is that while the behavior that the youth engaged in that caused the referral, while it's an expected, unfortunate behavior in teens today, it's illegal. So a common one are kids on Snapchat or Instagram sending pictures they should not be sending. And because they're children, that is classified as child pornography. And so we're seeing youth getting charges for things that are just within their, I guess,
Social norm.
their social norm, correct. Mutual sexual activity is another one. That's illegal. We get a lot of referrals for that because it's illegal if they engage in that. And I think in terms of the referrals increasing in the schools, I think that does correlate with kiddos being back in school. But I think also some schools utilize their SRO for their discipline. And so I think we're seeing that some of these referrals that come from school really can and should be dealt with at the school discipline level with suspensions, pre-expulsions, re-entry meetings, behavioral contracts, things like that. And oftentimes when a referral comes from the school location or community, the school has already done a lot of those things, but they're still getting a referral, which is then kind of like double jeopardy or a second consequence on top of what they already received at school.
And those are the things you're talking about at the school law meeting,
Yep,
right?
yep.
Go ahead.
Try to put my thoughts together here. So we're definitely seeing a trend, right? Your slide, oops, get to this slide. 37% increase for behaviors in the school since 2020. And while decreasing in a downward trend, overall for a period of time, it's increasing trend, right? So maybe a little bit to Supervisor Bossert is historically, what does that mean? But you just gave some insight whether it's right, wrong, or who's in the, if student behavior has changed and the PICS that you're talking about, yeah, that's been around for 5-6 years or more. And the kids don't care about it. That's part of their life and all the social media stuff. So yes, that gets out. So my question is, with the increase of that, but then the decrease of the disposition of open cases, so me and Yaris has helped identify that. So you get the human part of it is you go investigate, you find out, yep, my bad, I sent this, it was intended, and I've learned my lesson, versus all of a sudden now you're referred to DPAS or whatever, and then you get this label and stigma and et cetera. So that's just kind of factual. So then the question is, how do we change that behavior of the students so they don't realize that, look, unintended consequences, unintentionally, I might find myself as denoted as a sex offender, and that's going to tag me the rest of my life.
That's a good question. We're still trying to figure that out. I think the simple answer would be take cell phones away from children that have very impulsive brains. And I mean, we've gotten referrals for, like, for instance, recently we got a referral of a youth who posted there was a new Fortnite or some sort of video game coming out. And so he wanted to stay home from school the next day. So he put something on Snapchat like, oh, wouldn't it be cool if school got shut down for a bomb threat or something. He posted it for like 3 seconds. He said that I shouldn't have done that. He took it off, but by that time, like, more than 10 peers had seen it in 4 seconds. And then, of course, it launched an investigation. So I think once these kids, once they do something impulsively, they realize that they shouldn't have done it, but because it's on the media and now it's there, even though they take it down, the damage is done. And then I think we've seen an increase in closing the cases, even though referrals are increasing, because especially when it comes to school offenses, if it's already been handled within the school admin, then we oftentimes do not then put further consequences in the youth justice system unless that youth is moderate or high risk to reoffend, or if it's something egregious, a felony offense. But we get a lot of referrals for a kid swearing at a teacher, or a kid talking about that they like to play shooting video games, and because they said the word shoot in a school setting, they're getting a referral, but they were suspended, had a reentry meeting, have to meet with the counselor. So then and they're low risk because these are typical kids that are using words that are in their typical language, unfortunately, but they're very serious in certain settings and can obviously create a safety concern. And so when those things are dealt with at the school level, then we are not repunishing them, if you will, in the juvenile court system when that YAZI assessment tells us that we don't need to do that.
Wow. Wow.
I learned a lot.
Yeah, yeah.
Thank you, great questions,
So,
appreciate it. Conversation.
I guess they don't go on recess. What are the ages usually again?
So they have to be at least 11, and then up to 16. So once a youth turns 17, they are considered an adult if they have any sort of allegations of crimes. And we have unfortunately seen a spike of 11-year-olds being referred just this school year. And it's for some of those things that we just talked about, using the word shoot, or we had a referral for an 11-year-old who said she was going to kill her mom if she didn't get a cell phone for her birthday. Like, these are just like some of these but they're very serious words, right? And
But
so
she
they have
said it
to,
colloquially, not
Yeah.
seriously.
yeah.
Yeah.
And so we've seen a rise in that, in those younger kiddos with, again, those very impulsive behaviors and using those words that are a part of their young brains and culture now.
And the other question that I had is going from the court system to the Department of Children, I don't know the acronyms.
Families.
Yes,
Yep.
Children and Families. Is it possible that you saw an increase in referrals related to caseload burden? Like, was the court system, that route, did they have a bigger caseload and so they didn't refer as often, or?
I don't think so, because the system to handle these referrals in the state of Wisconsin remains the same that it did when Department of Corrections oversaw it.
Okay.
It just, the state oversight changed to a different mechanism, but the process has been the same in the Wisconsin statute for probably whenever it was
Since the 90s,
90s, yeah.
I think the biggest change you'll see with that is the change or practice shift from punitive and like juvenile probation is kind of how we all know this, right, to more of a treatment focused, even the coining it youth justice system instead of juvenile justice system, things like that. It's those shifts with really a focus on like treatment for mental health and trauma, and trying to change the underlying needs to the behavior that cause a child to act or youth to act out, right, where historically it was a lot more punitive practice.
And the push, DCF has also pushed the county entities as well to service these youth in the community, whereas I think when department, and this will chime into Coral's next presentation, I think when it was overseen by Department of Corrections, there were more placements, more kids going to like Lincoln Hills and group homes, juvenile corrections, locked treatment facilities. And so with Children and Families taking over, there's been a push to service these kids in the community, which is really why the state invested in the Yazzie assessment. I think it was developed like out in Maryland, I think, because it really looked at those mental health pieces, the family dynamics, their strengths, and how can we provide services within the community to not ship them away to a locked facility because they're labeled a sex offender now, but getting them local community treatment.
Wow, great. Any other comments, thoughts, questions? Okay, thank you very much, Beth.
You're welcome.
Very interesting.
Sure, if you want to, you can. I gotta just, give me 1 second, please.
Yep, no
tee
problem.
you up?
Coral is
Yeah, you
up-
want to? Go ahead.
Coral is up next with the out-of-home care and inpatient hospitalization report. That's the end of a year kind of look back.
So this is the end of the year report for both of these line items. What Coral is going to do first, specifically to out-of-home care, is just give you some data around the trends of the increased costs that we're seeing in out-of-home care. It was not originally in your packet, so it was printed out and is in front of you if you want to follow along in that way. So Coral's going to present that before I go into the dollars and cents.
I appreciate that. Thank you, Julie. And I will also add that I did add another slide this afternoon that is not in your packet, and I apologize for that. I'm happy to get it out to you, an updated copy of this presentation if you would like it.
No worries.
So just a couple of things to touch on around out-of-home care placement costs. I'm going to be talking about CPA costs, or child placing agency costs, and also residential costs, residential treatment costs. And then I will touch briefly on the number of children that we have placed in a 5-year look back. Well, I mean 4 years, but I did pull the first few months of 2025 just to look at how many kids we have in that placement to date.
Okay.
Okay, so this first slide, CPA again is child placing agency. And a child placing agency is more commonly known as a treatment foster care agency. So these are kids and youth who are placed in a level 3 foster home. The county, we license and recruit for foster homes who are level 2, but private agencies recruit and license and maintain homes that are level 3. These are homes that have a higher level of training. They are supposed to be prepared to take kids with a higher level of need. So not only do we pay these agencies a rate, a foster care rate, like we've heard about foster care rates, right? We pay a daily rate and a supplemental rate for each child in out-of-home care, so in a foster home, right? And that gets paid to the foster parent for the daily care that they're providing the child. What is here, this rate growth, is that a treatment foster care agency also comes with a daily administration rate. Okay, so that goes to the agency to provide a worker that goes out at least every week to see the family. They have additional clinical training. They really provide, these are supposed to be high level kids, right? High treatment level kids in the community. So they provide additional support to the family and to the child, and that is what we're paying for here. This is the rate that I'm talking about. And there's several more agencies in the state of Wisconsin, but these are the ones that we use the most. Specifically Pillar and Vine and Foundations. And I just wanted to touch on this because it will speak to the growth in residential treatment, which is on my next slide, which, of course, residential treatment is the next level if you're looking at a continuum of care, right? We've got kids in home. We've got kids in a level 2 foster home, kind of just another, I don't know, it's almost like another family, right? They have training specific to taking in foster care, but then level 3 is up here with additional support for really high level kids. And then in residentials, we're talking about taking those kids out of a community and putting them in a facility to receive mental health treatment. So the growth here for the child placing agencies, is about 30% from 2020 through 2025. you're probably going to wonder why Pillar and Vine is so low. We use them a lot, not because they're the lowest price, but because, quite frankly, they provide the best services to our kids. We have a really great relationship with them, with their executive director and their workers, and they've done a lot of great work for us, so I can't say enough about them. But the main attraction of my presentation is the residential care growth. So RCC rates, so every time a youth or a juvenile or a child is placed in residential treatment, we pay a daily rate for the care. So think of it as like a room and board rate plus a clinical treatment rate plus whatever else that youth is receiving for staying and living in a residential facility. Okay. The bar, these bars, the top bar is, or to the top of the bar, is the 2025 rate. And then the blue the blue line that going through it is the growth for that particular agency in their rate between 2020 and 2025. The dotted line you can kind of see in the back there is the trend line and growth across the board, which has been rates have basically gone up about 68% in the last 5 years. One thing to talk about, I know you're going to notice that Milwaukee Academy, we're 1, 2, 3, 4, 5 in, they've only had 14% growth and they don't have a bar. That is because in 2023, Milwaukee Academy, which is was known as Clinic Care, they ran Milwaukee Academy and Eau Claire Academy. Clinic Care dissolved, and Ladd Lake St. Rose absorbed Milwaukee Academy's girls program. St. Rose already had a girls program, but they absorbed specifically Milwaukee Academy's victims of sex trafficking and runaway girls program, a very specific program that they took on from Milwaukee Academy to their St. Rose facility. As you can see, some of these residentials have increased, almost 100% in their rates in the last 5 years. We have placed a lot of boys specifically over the years at Rawhide, which has gone up 10%. This year, they're about $881 a day. Genesee Lake, GLS, Genesee Lake School. We have a young man there who is has been a long-term resident. He has been there for the last 5 years. He is nonverbal. He has autism. He cannot do any of his own daily cares. And that placement has been about what's now at $807 a day. Family services we use a lot as well for girls. It is probably one of our favorite girls programs. They are $504 a day, and I would say that is on the low end. I wanted to call attention also to the last two bars. You'll see Youth Villages and Chaddock. Chaddock is a placement in Illinois, and Youth Villages is a countrywide health system that provides numerous services to kids and youth and their families, but we've specifically used them for residential treatment. We've unfortunately had to send youth who we cannot find a placement for in the state of Wisconsin to residential treatment. We've used one of their Inner Harbor campuses in Georgia. We've also used one of their campuses in Tennessee. They've started out as a higher daily rate, but as you can see, they've really only increased their Youth Villages specifically has really only increased their rate by 30%. They're a little trickier. Just something to say about residential treatments. So Youth Villages gives a daily rate for their for their residential treatment, and we get a daily rate for education. Wisconsin, I don't know if we're the only state, but we're one of the only states where the county actually pays, county human services agencies and Milwaukee Child Welfare pay for the entire cost for residential treatment. Because not only do we pay for the room and board and the clinical treatment, we also pay for educational services, right? Other states across the nation will just pay like the room and board. Medicaid picks up the clinical the clinical services. And yes, Medicaid does pay for medications and things like that, but wholeheartedly, we as in County Human Services are paying almost the entire cost of residential treatment. Across the country, it is not like that. The county pays room and board, Medicaid pays for the clinical services, and the sending school district pays the educational costs. So that has been on the table for a very long time. It's in statute, it would take a statutory change. But trust me, every time I'm at a state meeting, those conversations do come up. But I think it's worth mentioning to this group, kind of like the makeup of what a daily rate means in Wisconsin. It means everything to have a child live there, receive treatment, and be educated the way they are supposed to be. Sorry, I'm going to get on my soapbox and get out of the weeds a little bit. I apologize. The last slide, which you do not have, is the one I added today. And this is setting some additional context. Sorry about that. There, it's a little better. Sorry about that. It's kind of a messy slide, but I thought it was important. This shows our kids and youth in residential treatment from 2020 through this week, quite frankly. So 2025 just accounts for the kids from January and February of this year. So the bottom line are the kids in Child Protective Services. That is the orange line. The middle line, the green line, are our youth justice kids, and then the blue line, the top line, is just the total number of kids and youth that we've had in residential treatment. As you can see, we've been doing the outcomes show we've been doing the best that we can to make sure that we're serving kids in the community. Things like family-centered treatment and comprehensive community services, those really in-home, in-community services, getting kids, two things. One, not sending kids to residential treatment when they can be served in our community. And two, getting them home faster if they do need to spend a time outside the home receiving treatment and coming back into their communities. Our youth justice kids, they have a lot of mental health and trauma, which, leads to what we'd call their bad behavior. No bad kids, only bad behavior. So we really want to make sure they get the treatment that they need. But again, the services and the initiatives that we've had through Human Services and working really specifically with our Behavioral Health Division has really helped take those numbers down. I don't know if you have anything else to add. I could keep talking about it all night. I don't want to do that.
Yeah. So thanks, Coral. I think that it's very compelling data. And so we wanted to show you this data as we also presented the last 5 years of our out-of-home care trends. Primarily because if you've been on this committee in the past, you know that this is a data point that we're always chasing to make sure that our budget, comes out, in the good at the end of the year. And our out-of-home care budget is always overspent what we're budgeting. I would say because, as Coral said, the implementation of family-centered treatment, which is a huge initiative we undertook, and the growth in the comprehensive community services, we've really worked at reducing these kids in residential care at hopes of having it impact our budget. But what we're facing is you can see the data trends here. I feel like we're doing a fantastic job. Coral and her team are doing a fantastic job. But what we're up against is the rising cost. So as much as we're reducing and making sure that these kids are getting community services and really treating them in the home, we're not seeing the savings, so to speak, that we hoped because of the rising costs of placement. Although, if you look at the 2022 to 2025 budget to actual, we have seen a reduction in 24 over 23. So we have seen some savings in that way, but obviously we're also significantly over what we budgeted. So before I go into the inpatient line and talk about that, I just want to stop there because that's a lot of information and see what kind of questions you might have for myself and Coral.
Supervisor Bossert.
So I've heard the term value described as the nexus of low cost and high quality. And when we look at the value proposition of these, in-home, in the community obviously has the best value. It's cheapest and it gets the best outcome. And then when we have to go to out-of-home, we lose a lot of that value both in outcomes and in cost. It costs more and it's harder for the kids to maintain connections to their family, to their friends, especially like in those rare cases where we have to send a kid to Georgia. Like, how does a family maintain a connection to their child who's now in Georgia? You know, that's an airplane trip, or that's a day and a half car trip to get down there to see their child. That's, you know, we're going to go next to inpatient, and I'm guessing the value proposition goes down even more there. It costs more, and I'm betting outcomes are not quite as good. Is that a fair assessment, or?
Yes, I would say that that is a fair assessment, and I think the work that Coral and her team have done over the last couple of years is exactly that, is placing kids in residential when it's absolutely necessary and getting them home as quickly as possible. Alongside the rising costs of the actual daily rate, the other thing that we're up against is there's a handful, a small number of children who their needs are so significant and their family system is so irreparable that we only have the option sometimes of these out of home or out of state placements. We had a case last week that this team spent hours upon hours and late nights on, where every single door of the youth justice system shut the door in our face. And so we have a kid in Winnebago right now, which is not a practice that we ever follow, because we're trying to find a residential care placement for him, and it's likely going to be out of state. And so what happens with these very few kids who have such significant trauma and such significant issues within their family is we have no choices, and those are going to be your higher cost, your higher intervention kids. But our work is to make sure that we're providing that for those sort of deep end of the pool needs, and we're trying to move as many kids and families into community-based sort of work and reconciliation.
Yeah, and I heard Winnebago mentioned in that instance. I know Winnebago is the highest cost option, and they tend to have I don't know quite how to say it, but to say it bluntly, the worst outcomes. People, once they go to Winnebago, they tend to stay there a very long time. They tend to not get help. And so from a value proposition, that's the worst. So, yeah.
Can I just add something?
Yeah.
I can't speak to adult placements at Winnebago, but I can speak to child and youth placements at Winnebago. It is, like Julie said, absolutely not our number one plan or choice ever to have to. The last option, 100%. Yeah. And when we have a child at Winnebago, we are getting updates daily from the social worker. My team continues to work on alternate options. We meet at least weekly with their treatment team. Like they are, monitoring us and we are monitoring them, but we are being monitored, and we're moving forward to get that child out of Winnebago as soon as safely possible. And that is finding a placement that can meet his needs.
Yeah.
Yeah.
So I'll, if you don't have any other questions right at this time for out-of-home care, I'll move on to the inpatient data from 2022 to 2025. And as you can see, we're pretty in line with average year over year. We're a couple of years we've been underspent, a couple of years we've been slightly overspent. The big story here, I think, with inpatient specifically is the IMD line, which is essentially Trempealeau. That's an Institute for Mental Disease, which is Trempealeau. We had a number of individuals who were there long term. And in 2022 and 2023, the behavioral health team worked very long and hard to move those individuals into a community-based setting. And so we saw a lot of success there. And so that's why you see in 2024 that budget line item was reduced, because we had been able to move those folks to a community-based setting, which I think was a huge win for those individuals and the care and service that they were receiving. And really, again, the inpatient placements are year over year just based on what the need is, people's ability to draw down on their insurance, placement openings within other hospitals. The inpatient line item includes Winnebago, but it's also, Fond du Lac, Waukesha, some of those other hospital settings as well. I feel pretty good. We've stayed in target with the inpatient budget for the most part. We're not wildly overspent, and so I think some of the work that team is doing is seeing you're always going to have this expense. You're never going to be able to move away from it. But I will say overall, I know we present this twice a year, and sometimes it can seem very alarming because we're overspent in two large line items. And it is something that we track very closely and that we meet about every month. And year over year since in my tenure, we still have ended the year in returning some money to the general fund. So even though these line items don't look great from a budgetary standpoint, our bottom line is still fiscally healthy. And so I think the work that the team does to meet the needs of the community and try to do that in a community-based setting way as much as possible is hard work, and I think they do a really great job. And so, we continue to look at this and continue to work on making sure that we keep it in line while still meeting the needs of the community.
Supervisor Gallitz.
Statisticians and whatever we can talk about all kinds of, little gimmicks or point is, what are we truly looking at? Yes, okay, the budget is higher, but more importantly, how are we serving the needs of the people? And you can have one or two cases that will skew this, as just referred to, a high-cost case or high-needs cases. The next thing you know, one person could take your budget at $250K or whatever. So it's more about, the caseload and how we're serving those individuals. Are the caseloads rising? And if so, why are they rising, and what can be done, holistically in the community to try to decrease that? As we were looking earlier at youth, spending more time, at least I remember going through driver's ed and you had your scare tactics, right? Wear your seatbelt. Well, how effective does that work? Maybe for a second while you're watching the video, but after that, you lost it. So the point is, where do you focus from a success? I think value proposition is what Supervisor Rosser said earlier, is if we're managing our caseload effectively, but some of the costs are rising, can we do anything to help reduce some of those costs? And it sounds like some of it we can't, right? It's what the facilities are charging, and we know labor rates or whatever are there. So I think I would say a focus shouldn't be so much on the expense, but on the services provided, if that makes sense. Yes, we need to be able to budget. To your point, it varies widely. Some would say, well, why don't you take that 5 or 7 year average and use that as your budget point for next year, versus having the ups and downs like this. So from an accounting perspective, maybe that is an approach. But from a service perspective, that's wholly different. And it sounds like we're meeting the needs of the folks and the caseload, and we have the right amount of people. So if the budget fluctuates, I'm not concerned about that. And I suspect you or the rest of the board, is it because we can't pin this?
Correct.
We can't.
It's a moving target, yes.
Right.
I think the way I've heard it said is we have to control the elements that are within our control. Any day we could get a case popped up where the only placement is Winnebago and they end up stuck there at 6 months. And if their current rate is about $2,000 a day, which is probably a pretty accurate estimate, that's almost $400,000 that's sucked up on one case. But that individual still needs the treatment. So yeah, it's the best way I can figure to put it is, we gotta control the elements we can control, which are looking to intervene earlier so we can try to keep them in their home, because that's the most cost-effective option and the most successful one.
And if I could just add, I think one of the stories to tell is the paying attention of the service that's being provided, paying attention to individuals and the service level that they need and the care that they're being provided, is just our team just looking at every data point, every way in which we're doing the work very closely and regularly, so that we don't come to you at the end of the year and be like, oh, whoops, we weren't paying attention and it got out of hand, right? We are taking all the care and the supervision that we provide to these very high needs, very vulnerable people in our community very seriously, and are always thinking of ways in which we can meet those needs in a different way. So I appreciate your comments. Thank you.
Thank you. All right, any other comments, questions before we move on? All right, so the next agenda item is the Women and Children's Recovery and the Sober Living House update.
Yes, and so this agenda item will roll right into the next one, so hopefully they'll be quick for you. But I am pleased to share that we have made an award for our Women's Sober Living Facility. We've made the award to Pathways for a Better Living. They are a current treatment provider in Kiel, where they also have sober living facilities in Sheboygan County. Recently, they also contracted with Rock County and have opened up 2 facilities in Rock County and Janesville. So they were awarded that contract at the beginning of February. They have closed on a house on February 14th. In Hartford. And so they have a facility or a home there that they've purchased that is a duplex that has the capacity to serve 8 individual women or less women and children if they need those bedrooms for children. And so they closed on that home. I don't even know what day it is anymore, but on the 14th, a week and a half ago, we had our first planning meeting with them this afternoon. Around their policies and procedures and their operational contract. And they have a very aggressive goal to be able to take a first tenant or resident in mid-March. And so Friday, they are going to give me a date for an open house. And so we will send that information out to the county board to attend that if you're able. It's a great, looks like a great home. They've been a great provider. We've worked with them before for treatment services with individuals. So we're very excited about this and happy that this is finally coming to fruition. And so I'll leave it at that for any questions.
Questions at all? Okay, great. It's very exciting. I can't wait. Do they have an idea as far as the open house date?
Sometime in mid-March. She's going to
Okay.
let me know Friday.
Okay, perfect. Great, we're excited. All right, thanks for that. Women and children. And our last update is the opioid settlement funds update.
Yep. So Supervisor Schultes asked that I bring forward sort of where we are at with the receipt of opioid dollars. We, as I said, did award a $1 million contract to Pathways for a Better Living. That is not reflected in this spreadsheet because that contract just was executed. But as you can see, through 2024, we have received $2.6 million in the opioid settlement. But we do have $1 million earmarked for our sober living facility. So essentially what we have still on the books right now is $1.6 million. In the 2025 column, you can see there that what we anticipate receiving, but we have not received any funds for 2025 yet. It's been a very interesting receiving the funds because we don't get a lot of notification. and some days it just shows up in the treasurer's office. So, so this is our, this is what we've received as our best guess. Some places have given us payment up front, 7 years up front. And so this is, our finance director and the treasurer's office are trying to track this as closely as possible. What you will see in the 2024 column, I want to point out, is $25,000 that were expended. We have in the budget earmarked 60% of one of the new deputy county attorneys, or assistant county attorneys, I'm sorry, to work on the CJCC, which is the Criminal Justice Coordinating Council. Thank you. And so that some of those dollars are earmarked for the next couple of years. And so last year we expended $25,000. When I talked with this county executive about this, about planning for what we will spend the rest of the money on, at that time we were both in agreement that we wanted to get the sober living up and running and to not let the money burn a hole in our pocket. So now, we, as I said, we've awarded that contract. That's set to open in mid-March. And so I think our next steps then are to start doing an assessment of where the other needs are and developing suggestions and strategies for how we might use the dollars that we have sitting there and the dollars that we expect to receive over the next several years. I think the budgetary process, the 2026-2027 budgetary process, will inform some of this as well. But as we put that together, then we'll be bringing that forward to this committee for input and potentially, and I may be wrong, but maybe the county board has to approve it as well. So.
Any questions? Supervisor Galitz?
Yes, thank you, Chair. So if I look at this correctly, just shy of $9 million the county's going to get through 2038, is that right? And there are certain criteria in which the money has to be used or can be used, correct? So as a starting point, how have you looked at how best to spend that money? To maybe Supervisor Bossard's comments earlier, whether it be maximizing, optimizing, whatever term you want to call it, have we looked at those? And there's probably some low-hanging fruit that needs attention. We could do that. But then, based on even some of the other comments that we had here about youth referrals, well, we know there's a drug problem in Washington County. Let's not kid ourselves, there is, right? So can we use that money for education purposes, not only students but parents? So again, I'm just thinking aloud as how best do you utilize that money to get the best return?
Yeah, I mean, great points. So when we knew that this money was coming, we did complete a community needs assessment that prioritized sort of what the community felt at that time and what, based on our expertise, felt at that time were the top priorities to use this money. Sober living was number one, so we're working on that. So part of our work now is to revisit that needs assessment, do a little bit of reassessing of the community need and what has changed, and then make those recommendations for how we might expend that money going forward. I think one of the things that we also have to think about is if we're going to fund an ongoing program, it sits there like, a fair amount of money. But when you fund an ongoing program, they are going to need ongoing funding. So, depending on the cost of that, then for this committee and the board to determine if that's where we want to spend our money for the next X number of years. Or, is there something in the criminal justice system where we could make a bigger impact? So I think there's a lot of bubbling ideas, and we just need to get a formalized proposal together on where those areas that we might have the best impact could be.
Right, yeah, absolutely correct. Any reoccurring expense, you can't use this money because it's going to dry up. Mm-hmm. So unless you have some form of a revolving program.
Any other thoughts or comments?
I'm going to throw in, I'm glad we decided to join the opioid lawsuit. This is bringing in $9 million to help deal with the drug problem that does exist in our community. And, you know, I don't know if it's 5% of the community that has a drug addiction, or 2%, or whatever that percentage is. But if it's 5%, that's 5% too much. We'd like to get it down to 0. Probably not going to happen. I'm a realist. But it's good that we brought this money in. I know at the time it was very controversial. There was a tough discussion about this. But yeah, I'm glad we brought this money in, and let's put it to the best use we can. So thank you.
Thanks.
Yeah. Great. Any other questions, comments? All right. Full agenda today. Great time learning more about the facilities and the services that we provide to our community through Health and Human Services. Our next meeting date will be March 26th. This meeting